Hello everyone and welcome to another episode of Ask Dr. Bob. We have some very interesting questions today and we do appreciate you sending them in. Someone wanted to know a remedy for plantar fasciitis, and I want you to know from my experience it's usually a need for vitamin B6, which by the way we see on a blood test a lower liver enzyme. So if your liver enzymes are low, we supplement with vitamin B6 and also essential fatty acids. I'd encourage you to use optimal EFAs. The B6 helps the EFAs reduce pain and inflammation in your body. That'd be the first step that I would try. A gentleman was concerned about his wife. Her pH was very alkaline, up to 8 on a pH strip. He also mentioned she was having some challenges digesting foods like squash and squash soup, and wanted to know how to lower the pH. Oftentimes I find that citrus tends to raise the pH, someone's saliva pH. Oftentimes we'll use a digestive enzyme with betaine hydrochloride. Going back to the blood chemistries, look at her CO2, carbon dioxide. The lower the level, the more acid she is, the higher the level, the more alkaline she is. Dr. Bob, I'm taking lisinopril for my blood pressure and I want to know what can I do to lower my blood pressure. First, I'd like to refer you to Natural News. I did an article, a 1-minute tip on blood pressure, and there's a wonderful set of notes there. We use aqueous magnesium chloride 2 teaspoons before bed. Please make sure that you talk to your healthcare provider. That's very important. Dr. Bob, my immune system is very weak and I want to get healthier. I have shingles, Sjogren's, fibromyalgia, and osteoarthritis. The first thing I'm going to tell you is to get off of gluten, dairy, and you want to minimize or eliminate sugar, because sugar compromises the adrenal gland. Gluten clogs up your intestines so you cannot absorb minerals, and the liver is plugged up by all of those, and the liver is very important for osteoarthritis. I would suggest that you may consider Dr. Bob's ABCs, apple, beets, and carrots. Your immune system itself will get strong on its own if you stay away from some of those foods. I also would encourage you, I use about 4,000 units or 2 drops of vitamin D on my tongue every day. That helps your phagocytes in your body, which are part of the natural immune system builder. And another natural drugless remedy would be bouncing a ball. I bounce in a ball, about a 55 or 65 centimeter ball every day. It helps your lymphatic system. Dr. Bob, I have tinnitus or ringing in the ears. What can I do? Low thyroid is very common in individuals who have tinnitus or ringing in the ears. Oftentimes we see a mineral need. Have your thyroid checked. Low thyroid. Have your TSH, your T3, and your T4. If your T4 is low, you need to supplement accordingly. I also want you to know that we do use a product called A-Emulsion, which is a liquid vitamin A, and has been used to help support ringing in the ears. Dr. Bob, I've had fibromyalgia for about 3 months now. What can I do? What I have seen with fibromyalgia, it's almost always an adrenal fatigue. There's a wonderful book called Adrenal Fatigue by James Wilson. Read that book. That's one of the reasons that I suggest and encourage our practice members to stay away from fruit. Fruit and sugar compromise adrenal function. Your adrenal glands make natural cortisone. Dr. Bob, I have back spasms that last about 10 hours. Well, I want you to know Doan's pills from a long time ago, it was magnesium. I would encourage you to maybe try some aqueous magnesium chloride or magnesium orotate, and find yourself a skilled practitioner that knows how to assess the lumbar spine. My name is Dr. Bob DeMaria, the Drugless Doctor.